It's a new season of Between You, Me, and the Speculum with Dr. Ju. On today's episode, 'tis the season, hot flashes, and night sweats. Dr. Ju speaks about menopause, what it is, what you should expect, and what you can do about it. Make sure to comment, like, share, and subscribe to join Dr. Ju as she delivers, pushing wellness for women worldwide.
Hello, everyone. My name is Dr. Julianne Birt, and it is my pleasure and privilege to share with you today about menopause. I actually am here recording this in London. I had the pleasure of participating in the new chartering of a chapter of my sorors of Alpha Kappa Alpha Sorority Incorporated. So wanted to get on here and share all about menopause, or a few things you need to know.
What happened that night? You said things were fine. What changed? What are you avoiding? Men, talk about it. Why can't we?
Hi, I'm Dr. Julianne Birt. 43% of women experience a sexual problem, yet they don't want to talk about it. We can help you feel the way you used to. So talk to us. Visit radiantwomenshealth.com today.
Menopause is defined as the cessation of your menses for at least 12 months. 12 months consecutively. No spotting, no bleeding, no I see a little bit of brown when I wipe, for 12 months. And it's also important to know age-wise, because sometimes you can also stop having your periods for 12 months and it not be menopause. So that's very important to share and discuss with your primary care physician, your gynecologist, what have you. So we know that there's nothing pathologic going on. Most women enter menopause somewhere between the ages of 45 and 55. The average woman is around 51 and 52 by the time she will stop. Now, clearly, there are many women who will never be able to use that definition because they've already stopped having their periods, either A, surgically, or B, because of treatment, medications that they may be on. It may be because they had a procedure, such as an endometrial ablation, where their periods stopped. So therefore, it's important for you, again, to discuss with your doctor, because we may have to be a little bit of detectives to be able to describe it.
I was having a miscarriage, so when I met Dr. Birt, she was very caring. After that, I successfully had another baby. I suffer with postpartum depression, and Dr. Birt helped me realize it's part of the hormone changes in our female body. If you're looking for a doctor who's compassionate and invested in you and your baby's health, come visit Dr. Birt.
Visit Radiant Women's Health in Conyers, helping you shine from the inside out.
So, what symptoms typically accompany menopause? Of course, we know about the hot flashes. We've heard about the night sweats. Night sweats are just hot flashes that you have during the night when you're unaware until you are awakened with this heat that has overcome you, and typically you are just so sweaty and wet. Oftentimes, one must get up and change. But there are other symptoms, and most women do not really relate to menopause, but I want you to be aware of them. Things such as mood swings, depression, anxiety. It could be your weight, difficulty. Once estrogen starts to fluctuate, and especially when it is nearly gone, you will notice that your fat redistributes and then lies right in the middle area in the abdomen. Also, we may be dealing with sleep disturbances, decrease in energy, just an overall sense of fatigue, libido can drop, and most worrisome is vulvar and vaginal dryness. The reason why this can be worrisome: the hot flashes, the night sweats, even some of the mood changes, the weight can stabilize. The other things can seem to go away or just get stable. But if you have genital urinary syndrome of menopause, which is the vaginal dryness, pain, maybe with intercourse, with penetration, burning, itching, burning when you urinate, all of those things, we define that as genital urinary syndrome of menopause, and unfortunately, those do not go away. So oftentimes we're asked, can I do anything about them? Well, there are a lot of things that you could try. Start paying attention to what triggers some of your symptoms. Is it the foods that you eat, fatty foods, fried foods, alcohol? And you may want to avoid those things, especially if you are scheduled to get up and do a presentation, personal experience. You don't want that to happen. And you also want to consider layering your clothing. Exercise may help. There are hormonal and non-hormonal options to help with menopause. What I tell patients all the time, and family and friends, just don't suffer. There is help for the symptom of menopause. But it's important to have these conversations because there was a time back in 2002 where there was all this scary breaking news around hormone replacement therapy. And I'm just going to say in a nutshell that there is good reason for women to want their estrogen. And I have plenty of patients who, beyond the ages that are now recommended, it's recommended that if you want to start hormone therapy, you do that within the first 10 years of menopause, or at least before the age of 60. But I got my 70 and 80-year-old women who said, Doc, I need my estrogen. And why is that? Estrogen can be heart protective, bone protective, and brain protective. So I will add a few other things. Estrogen is vagina protective. It could be mood protective. So there are just so many benefits. I saw a woman, her skin just flawless, without Botox, without any kind of regenerating techniques. Beautiful. And she was proud to let me know that she was still getting it on at the age of 72 without any problems. So estrogen has its benefits. Of course, there are concerns in certain patient populations. Those are things that you need to discuss. I am so happy to be joining this panel, and I will see you with your questions and hope that you'll meet us there. Bye.
Thank you for watching. The conversation continues at Dr. Ju Delivers on Instagram and Facebook. Head on over, follow, and get more insights, highlights, and tips about today's episode. Remember, Wednesdays are for pushing wellness for women worldwide. The content shared on Between You, Me, and the Speculum with Dr. Ju is for informational purposes only. While Dr. Ju is a licensed physician, the information provided should not be considered a substitute for professional medical advice. Always consult your primary care physician or healthcare provider before making any changes to your health or wellness routine. The views and opinions expressed are those of the host and do not represent the views of any medical institution or organization.